think we'll go ahead and get started so that we can give as much time to our panelists as possible. So again, good afternoon, everyone, and welcome to Nourish to Flourish, diet-based interventions in cancer prevention. This is part one of a two-part series hosted through HRSA's Accelerating Cancer Screenings program. My name is Jennifer, and I'll be moderating today's session, but I am joined by three wonderful panelists that I will introduce in just a moment. Today's session is designed specifically for our health center team, so providers, nurses, care coordinators, patient navigators, quality leaders, and wellness staff who are working every day to prevent chronic disease and improve patient outcomes. Today's session is going to be a fast-paced, practical conversation focused on how health centers can bring food as medicine principles into everyday care. We have chronic diseases like diabetes, hypertension, and obesity-related cancers remaining leading contributors to preventable illness, and then also later down the road impacting cancer rates. And so we want to go ahead and have those conversations today about food, behavior change, and accessible wellness support. So our goals specifically for today's session are to explain how healthy eating patterns influence chronic disease prevention and cancer prevention as well, and then identify common barriers patients face around food access, share workflow-friendly ways to bring nutrition into cancer screenings and care, and then also highlight the role of wellness coaching in motivating change. So throughout the session, again, please use the chat or the QA. We'll address questions at the end. So if you do have them, feel free to put them in the chat, but we will pause and hold to answer questions until the very end of our session. Today's session does have continuing education credits available. So I'm just going to go ahead and put this up on the screen through Weizmann Institute. I will share later on in the chat how you can access those continuing education credits, and then also send an email following this session with more information and an access code to access those credits. So now I'm going to transition over and introduce our panelists for today's session. I'm going to go ahead and start with Hawao Bourjouan, and I'll hand it over to you as you can introduce yourself and share a little bit about the work that you're doing.
Hi, thank you so much, Jennifer. Appreciate it. So yes, I am Hawao Bojuan. And so for me, my focus and specialty is chronic disease management, food insecurity. So with everything that's been going on now, so many people are finding challenges having access to food. So food is a basic need that no one should be starving. So that's part of my thing. And we know that how important food is, especially in chronic disease management. So the first thing, getting access of the person to food, and then getting them on the nutrition component to manage their chronic disease with food. So that is definitely my focus that I enjoy with my clients.
Thank you so much. Our second panelist that I will introduce is Dr. Dorette Nicewonder. She also goes by Dr. D, and so I'll hand it over to you, and you can give yourself a brief introduction.
Thank you, Jennifer. It's nice to be with all of you today. We are wellness experts, so we work with practitioners that focus in chronic disease. We look at the whole person, and we never identify them by their health indice. We work in a way that encourages them in whole body care, whole body thought processes, and what is possible. And that work started with launching the first health and wellness centers and a shared services strategy of EAP, wellness and fitness, occupational health, and industrial hygiene and safety. And I was on that team and the team that stood up the first fitness and nutrition guidelines. We pushed them into 100 allied health and wellness programs in 73 countries. So it's nice to be with everybody.
Thank you so much, Dr. D, for joining us. And our third panelist for this afternoon's series is Carl Boynton, and I'll go ahead and hand it over, and he can introduce himself as well.
Hi, I'm Carl Boynton. I've been in produce for over 45 years. We do a lot in food safety and security. Uh, we work with food as medicine, food boxes, trying to bring healthy foods to people in need that treat these illnesses, diabetes, cancer, and that's the project we're working on right now.
Great. Well, thank you, all three of you, for joining us this afternoon. We're going to go ahead and dive into our moderated Q&A. So what I will do is I'm going to go ahead and ask a question, and all three of the panelists will have an opportunity to share and engage on that question. And maybe we'll just go in terms of how you were introduced. So that way we just keep the pattern the same as we go through. So
Good.
I will go ahead and just start with the first question. What does Nourish to Flourish mean to you in the context of cancer prevention and screening? We will start with you, Hawaii.
Nourish to flourish. To me, oh gosh, it means a lot. Many possibilities, I'll say that. So for me, I would say it means just from a nutrition, like as a dietitian, looking at the person as a whole. And I think it ties into also what Dr. D said, looking at the person as a whole and making the diet fit that person, their lifestyle, their preference. It's a partnership. And so the aim is for I and the client to get together to a place of flourish together, actually, not even just the client, both of us together. So that's how I look at it. Just looking at the whole person and what do they want? What is their, what are their boundaries? What are they willing to incorporate? What are they willing to give off? And also make it flexible and make it fun and make it enjoyable that it doesn't feel like work. You know? So that is my own thinking of it.
So I'll jump in here. Thank you, Hawa. It's amazing. I would say food is medicine and medicine is food. So, as
Well said.
practitioners, when we ask our clients or patients to do something and they do it, we should say the medicine and food is medicine and medicine food is that shared partnership. So, if they do, they need praise. If they do and they have some challenges, it's up to us to change it around. The second thing that I would say is teach in a way that people can grasp concepts, not these wonderful theories, not what we've done, but what they can comprehend and apply. Nobody has a nutritionist like Hawan in our back pocket. So we are familiar with the doctrine of signatures. There's 17 foods that nourish our body and they mimic the organs we have in our bodies. So it's really looking at the body from the inside out. The last thing that I would say is the body is 60% water and we are critically dehydrated as people. So we need to focus on that. So thank you.
Nourish to flourish to me means exactly what we're doing. We're taking food and making it medicine. I've talked to a lot of universities throughout the country, and unfortunately, the government has spent hundreds of millions of dollars researching. And I think the most common sense thing I heard was from the researcher at Ole Miss here, where she said, Carl, we've been researching this till the cows come home. We know food is medicine. We have to do something about it. And that's what got me involved with the Project Food Box and supplying healthy foods that actually treat chronic illnesses and obesity. And again, nourish the flourish, that just means eat right and live longer. And that's exactly what food as medicine is. And we have a platform to get it launched, and we're working on that right now.
Great. Thank you, all three of you, for your answers to that first question. It really seemed like there was a common thread between all three of them, which is that we need to begin to put nutrition at the forefront of these conversations. And so it's a great segue into our next question. What is one small, accessible nutrition change that creates meaningful impact for patients? And I'll go ahead and let you go, Hawao, and answer that.
What is a small that means meaningful? So small change would be, so let's say a client, they went just assessing, looking at how they're eating and everything, and you see, and they're able to find out, oh, I'm not drinking enough of water. Just that small step is a start. Even drinking a certain amount, I'm starting, let's say the person was just doing 2 cups and they go to 4. We're not going to just jump straight to 10. It's a gradual change. So even that small step is significant and the person should be praised because it's not easy. It's very easy to option for the soda instead of the water. So the fact that the person was intentional and optioned that water, that is a significant step. So that's just an example, just starting small at a gradual pace till then we can get to where the desired goal.
So, three things that I would say to compliment Hawa is change is hard. If it was easy,
Mm.
everybody would do it. And so
Yes.
the communication needs to be guided, and it
Mhm.
needs to be guided with what the patient or the client is willing to do. And when they make their decisions, then it's more powerful because if they set their goals, make their decisions, and we can support them in that, now they're in charge of them, not us. Motivation is intrinsic. I could tell you all day long how great you are and what you can do, but if you don't believe it, it is not going anywhere. So, through motivational interviewing, like I just gave the workflow of, when people make their decisions, they are stronger, they're more compliant. Um, it's a true shared partnership. And I always want to make sure that they know that I know that we know where we're going. So I've used a tool before called GAB, GAB. So the goal has been set. I want the patient or client to assess on a scale of 1 to 10 their confidence level in delivering that. And then the B is, what are some barriers that might get in the way and derail
Yeah.
you? And let's talk about that before you leave today so that we make sure you meet your goal. So.
What's that?
Well, since my background's fruit and vegetables, I say what we need to do is just start learning how to eat healthy. And there's fruits and vegetables out there, especially fruits that you can eat that will help mitigate some of your problems. And they taste good. So really the idea is, the top three fruits to consume that actually help you the most are watermelon, kiwi, and apples. I eat an apple a day. I love watermelon. So people have to start learning to snack differently. I know the sugar rush is what everybody's looking for, but if you want to get healthy, and a lot of people do, you just have to make that choice to change your snack habit. I mean, instead of potato chips, which are the worst thing for you, instead of pop, eat watermelon. Watermelon is great for you. And the funny part is most people love watermelon, but they don't choose it as a snack because it's so much easier to grab a bag of chips. And if you're ever going to get healthy, you got to change what you're doing, and that's the goal to me. It's for everybody, just fruits and vegetables. Eat 7 a day.
Thank you all. Um, as we're discussing change, one of the pieces that often comes to the forefront when we're trying to motivate individuals to make small changes is that it can be challenging due to barriers. And so, what, in your opinion, are the most common food-related barriers your patients or people that you interact with on a daily basis experience, and how have you been able to address them or help them navigate through those barriers and challenges?
I would say I'll let Dr. D take this one, and I will.
That's
You know,
fine.
my
I
my
can
brain
talk
is
all
still
day
processing
long.
it.
They may not want to listen, but I can talk all day long. Well, three strategies that we've used here in the United States and across the world are um, horticulturists. Did I say that right, Carl? Have taught us how to use pachyderm poop from the zoo and build these garden boxes to put on the top of small businesses near the air conditioning units. And the seeds that we purchase are fruits and vegetables. And that process hydrates that garden box and it yields a lot of fresh fruits and vegetables right on the rooftop of a small or medium sized corporation, which then the spillover assists them in their cafeterias, and then multitude goes to food deserts. And so, when people are looking for access to good foods, we have technology now. We have geolocators, and if we have the food pantries, the Feeding America, the this, the that, the other thing in a community, we can make that available through an app, and everybody knows where they can go to get good, healthy foods. As far as affordability, that's another barrier that we're constantly being challenged by. And a lot of communities today, both in America and out, are building residential areas around fruits and garden co ops. And if you use green bags, you pay a monthly fee, you get so many fruits and vegetables. The green bags preserve the food longer. And so, your dollars and cents stretch further. We have government benefits, SNAP and whatnot, that we can utilize. And if people were incentivized to buy healthier food or use their benefits for healthier food, I think that would help a long way with their personal health as well as the affordability. I know in speaking with many executives in grocery chains that if they know they have a rural area or a lower income population in the area around them, they take that grocery store and they reduce prices 20 to 25 cents to make 20 to 25% to make food more affordable. So, three things, striving to support food deserts, geolocators with technology, and affordability through the means that we have set up today.
And I would say to add to Dr. D, so community gardens, you don't have to have a whole big land to just start. You could just start from your little garden, the little yard there. Start with tomatoes, start with different things, and you're getting it fresh and you're saving a lot of money. So that's also a great way to address these challenges.
Okay, well, I done forgot the question now, but it actually uh, providing produce, fruits and vegetables, you know, per pound is still the cheapest way to be healthy. Uh, I went and did a veterans Christmas dinner, and for supplying all the fruits and vegetables for it, I loaded up a cart by buying all the stuff that wasn't the top dollar stuff, but bananas, oranges, vegetables and stuff. And for less than 150 bucks, I had enough stuff to feed 60 people. So, actually, it's for getting nourishment at the right price. Really, to tell you the truth, fruits and vegetables not only are the best things for you, it's actually the least expensive. At stores and stuff, the only reason why they're so high is because of the regulations and the labor and stuff. Fruits and vegetables are actually dirt cheap. If you go to a farm or a produce stand, they're actually very inexpensive compared to most anything else. And especially when you're talking about meats and dairy and stuff, it's so inexpensive to change somebody's habit And again, like I say, fruits and vegetables, once you get used to eating them, besides the health effects, it just becomes a norm. I mean, I'm uh,
I
not
love
losing
what
no
you
weight, but I eat a lot of vegetables and a lot of fruits, and I feel great. And again, it's just a mindset where you get used to eating the right foods. And nowadays, there's a lot of food safety involved in this as well too, which should make it a lot healthier for you. I just worked on a documentary with the former First Lady of Florida, Carol Chris, and we're working on regenerative farming. So there should be a documentary coming out on that, and that's another healthy way to keep the soil healthy by keeping the nutrients in the soil instead of tilling it and releasing them to the atmosphere.
I love what you do, Carl. You're always putting a bowl of fruits and vegetables in the pathway of people activities on a daily basis, and that makes a difference. You know,
I,
you pick up an apple versus going to the cabinet and pull down potato chips, like you had said. So, yeah.
All righty. Well, I'm going to go ahead and ask one of our final questions since we are a little close on time for this first part of the series. And it's a little bit two-pronged. So, depending on your engagement, feel free to answer one or the other. But we know that one of the challenges with our clinicians is that they are overburdened. There are a ton of things that they are trying to handle as they are seeing patients. So, on one side, how can providers incorporate nutrition conversations into their already busy clinical workflow? And on the other side of that, then, um, how can they use motivational interviewing or other coaching techniques to support patient engagement in that conversation? So it's a loaded question. Feel free to take one or the other, and then we will dive into participant questions.
Back in the cycle again. I'll buy.
Go ahead, Carl. You can go first if you'd
Oh,
like.
okay. Well, motivational. I mean, it's very simple. If something is wrong with you and you're used to treating it with medicine, I mean, any patient that has the option of taking a pill or a shot, I don't think it would take much motivation to give them a prescription on how to actually get healthy.
Right.
We prescribe fruits and vegetables for all diseases, cancer, obesity, diabetes. We have a food box for all of that. And so, motivationally, and this is one of the reasons why we're doing with Dr. D and stuff, what we're trying to do is bring this out to the mainstream to where instead of throwing away money in Medicare, Medicaid, SNAP benefits, where we're making everybody unhealthy, if you actually prescribed a box that helped them, it's pretty motivational. We did a giveaway up in Greenville, Mississippi, and we gave away a semi load of our produce boxes. And we had people around the city lined up to get them. And it just goes to show you people will eat it if it's available. But if you give them options, and unfortunately, it's like insurance company. Insurance companies will give you $60 a month or $40 a week or whatever it is to go out and buy healthy foods. But buying healthy foods, most people don't know what that is. So if you go out and buy $60 worth of bananas, well, I ain't gonna help you any. That's why you have to have a prescription. And that's what we do. We prescribe something that will actually affect your body and help treat what that chronic illness is. Again, unfortunately, you don't want to say you want to take away that ability from somebody, but if you got $60 to buy healthy foods, you're not going to buy the most healthiest foods that are going to treat the problem you have. So motivation to me is if you're sick, I would rather not take a pill. I'd rather eat a watermelon, a kiwi. That's motivation to me.
Okay. So I would say for the question regarding the nutrition conversations, incorporating in a busy clinical workflow. So for me, most times when I'm being called as a registered dietitian, That is my work line. So coming in, that's what we're going to talk about. And I always start with, I'm here to ensure you're fed and nourished. And that's my opening statement when I get there. And and so for me, it's right up in my line. We're talking about nutrition, what are they eating? What are they open to eating? The flexibility, small steps, and what are their concerns? What is the challenges? Because some things are intimidating for some patients. There's some even starting a diet is hard, to be honest. Even knowing where to start from, similar to what Carl said, like what to even pick that's considered healthy. It can be overwhelming. So for me, the aim is to de-whelm it, lessen the intimidation and the overwhelmingness and just make it flawless and just easy that it doesn't feel stressful. It doesn't feel like, oh my God, I'm being pulled in different directions. So the aim is to make the process and transition as smooth as possible for the client and also making them feel that they are in charge because they are. Ultimately they're in charge of it. The aim is long-term behavior change. So they have to be the one to drive it, and we serve as guidance to them towards getting them to flourish. And the other part of how the motivational interviewing, so going there and it's a partnership. So for me, when I come in there, we're in a partnership together. It's not just me coming in, okay, this is what you need to do. No, 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 no. What would you like to do? What are you open to doing? What is the situation? What are the challenges that will prevent you from doing what you need to do or where you need to get from A to B? So these are very critical because if you're not asking it, you're not knowing. And so the person comes back again with the same challenges because those challenges were not addressed in the first place. And so here they are, they have not changed, they have not grown, they have not incorporated what they need to incorporate in order to actually flourish. And so listening to them, reflective listening, this is what I'm hearing. This is making the client feel seen and heard, that I hear you, I hear your concerns, and I'm here to support you towards a quality of life.
Thank you.
So,
Uh,
so
I'll
one,
just chime in real quick, Dr. D,
yeah,
let you know that
sure.
we are at time. So if you want to maybe keep your answer to about 30 seconds so we can wrap up for our participants. Sorry about
Uh,
that.
Very, very quickly, I want to wrap you into the next session. So I want to tell you next week I'll be talking about a nutritionally related cancer outcome case study that I was a part of in another country. And there's a lot of fruitful benefits in that. And I would just say that we need to utilize every skill set in a clinic to their potential, supporting them with the what they need to do their job the best. So with that, I'll hand it back.
Thank you so
Oh,
much.
wait a second. Can I give a homework assignment?
Sure.
Yes, for everybody still on the line, if you would you tell us what your challenges are, what your problems are, your needs are, however you want to phrase that? Send it in right away, and then next week we'll provide some evidence-based solutions that are scalable. Okay?
Thank you so much. I do not see any questions in the chat. I don't know, Jess, if there are any in the Q&A either. But while we're waiting to see if anybody does have a question, I just want to thank all three of you for your time this afternoon. Conversations like these are really equipping our health centers and our providers with new practical tools that they can use and take away. So thank you so much. I want to remind everybody that this is just part one of this series. Part two will be on February 19th. So please do register for that event and come back into the room so we can have a more dedicated conversation, like Dr. D had said, about actual cancer intervention and prevention. So I want to thank you all. You'll be receiving an email from me that will go over how you access your continuing education credits and then also a survey for today's session. If you wouldn't mind completing that, we really appreciate your feedback. I also just put the link in the chat. So thank you again, all of our panelists and those who attended this session. We wish you all a great afternoon and look forward to seeing you on the 19th.
All right.
Thank
Thank
you.
you.
Thank you.
Bye.
Thank
Bye.
you.